Hello, everyone, and welcome to Alert and Oriented RN. This is a podcast for nurses by nurses. I'm one of your co-hosts, Luke, and I'm joined by one of my best friends and nursing colleagues, Tori. Tori, say hi to the people.
Hey, everyone.
So me and Tori have been talking about doing a podcast for a while now. Wanted to put something together that's exclusively for nurses, kind of talk about the ins and outs of nursing, but also kind of, add our 2 cents or our reflections on our careers up until this point. But to also talk about, certain things that come up within our field that are relatable to other areas of the nursing profession, kind of bring some insight and guest on in the future in different areas that they work in to offer, their recommendations or just kind of what their career looks like. But really just kind of be a platform or a place where other nurses can feel relatable or feel like they can share certain things. Or just laugh and cry with us if that's the case be. So me and Tori met in nursing school 6 years ago now.
Oh my God, ew.
Long time ago. Both very, hit it off pretty early, similar backgrounds, both second degree seeking nursing students, looking to join this great profession. So, without that, I'll kind of turn it over to Tori here and let Tori introduce herself a little bit more.
Yeah. So my name is Tori. I work in the pediatric intensive care. I used to do intermediate care before, so almost kind of like a tele floor. Luke and I actually worked on the same floor. I'm a night shifter. Shout out to all you night shifters out there. Struggle bus is real. I already had 2 cups of coffee before this, so I could be on Luke's level. But I've been a nurse for 3 years. I just celebrated 1 year in the ICU, and I love it. I love bedside. Everyone's always like, I feel like people talk about bedside like it's not an end all. They're like, well, what's your plan? I'm like, I actually really like bedside.
Yeah, I know it's weird. There's so many different areas of nursing, but I would say the biggest area is the bedside nursing, but it's almost like when you start at the bedside, everybody immediately is like, well, what are you going to finish?
Yeah.
It's like, well, why can't I just finish as a bedside nurse?
Yeah, exactly. I had one of our intensivists was like, so what's your plan? And I was like, oh God, I thought this was it. I have 2 degrees. Like I have a degree from Texas A&M, Gagum, shout out. And Luke is salty. And then just got my BSN from a private Catholic university. And I was like, yeah, this is it. And then so many people that I know are going back to school, which you are, and I'll let you elaborate on that. But as of right now, I really like what I'm doing. I just recently switched to the ICU. I celebrated my 1 year, and I just now am really starting to feel confident and comfortable in what I'm doing, and I really like it. And I just kind of want to see where it goes.
Yeah, absolutely. And I got to say, shout out to you for everything that you've accomplished so far, because it was cool. I graduated a semester ahead of you and had already started my career on the same floor that we both started on. But it was awesome to see you kind of jump in, basically 6 months after me and kind of hit the ground running too and just flourish. And then now moving into the ICU where we still, closely work together. Obviously we don't work on the same floor, but because of my area of nursing, we do, work in partnership together because unfortunately sometimes my kids end up with y'all. So it's been awesome to see your career kind of take off and just, super proud of you up until this point. So
thanks. The feeling is mutual.
Yeah.
I remember when I first met you, I was like, I don't know how I feel about this guy. He's too confident. You weren't like cocky. You were just like really confident. But I liked that, of course, in a sense to where you look, a patient wants a nurse that has confidence and knows what they're talking about.
Well, I just didn't want anybody to think I was scared shitless.
That's true. I think fake it till you make it.
But there's a difference in our profession because if you truly don't know it, don't fake it because you can harm somebody.
For sure.
But there is a lot of, if you have to exude certain confidence in certain things because it will drastically make your patient more comfortable and the families because we both work in peds.
Right. So the families, you got to be able to talk to your patient and relate to them on their level, the developmental level. And then you got to be able to talk to the family and educate.
Absolutely.
So.
Absolutely. But yeah, so a little bit more, about myself. So like we said, we work together, but I work in pediatric oncology and transplant. We're the only facility, within our area of where we live that do stem cell transplants, basically, and we service a massive amount or square area, I guess you could say, of the state when it comes to that. And when we say we work closely, unfortunately, a lot of the times, we function as an ICU, but there are certain things that do happen within my world that get to a point where are outside of our, I guess, scope of practice, you could say. And so that's why they end up on the ICU there with Tori and the rest of our colleagues. And so we do work in close partnership from that standpoint. But same nursing school, small Catholic university. Honestly, I think a lot of the reason why I am today in my career and in grad school is because of where we went to nursing school. But, again, second degree student myself, shout out to Sam Houston State, eat 'em up cats, baby. 4 years there and then joined, the nursing profession here at the school that we met. But, it's interesting because, let's kind of get right into it. The grit of, I guess, of this podcast, this episode, other than just introducing ourselves. But when we were talking about this, we really wanted to kind of figure out what was going to be the most important thing to introduce to the people, introduce ourselves and what we want to bring this podcast. And both of us, I think, agreed pretty quickly that we wanted to touch on, the culture of nursing. And it's really easy, I think, before we get into it, to preface it, that it'd be really easy to kind of touch on the pandemic and everything that's going on. And I think we will. But what we really wanted to hone in on is just the actual culture of nursing when we started the profession and where we are now. Because, 6 years is a long time. I mean, you see and you do a lot of things, and a profession can change drastically in that amount of time. And so what was interesting to me that you were telling me earlier and stuff, and we've talked about it multiple times before, is that what was crazy for you was the first day you stepped into nursing school, you really had no idea what nursing kind of was like or what to expect. I didn't want to say what it was like, but what to expect until we stepped our first day onto a unit in a hospital, and you're like, oh, wow.
Oh, it was a culture shock for sure. Because I remember I first got into nursing because I knew that I just wanted to help people. I feel like I always felt like there was a calling. I think that nurses, it's always, why do you want to be a nurse? What was your calling? There was always an incident. There was always something that happened. I actually never had an incident in my life. I've never been in the hospital. I've had family members in and out of the hospital, but myself as a patient, I've never experienced that. But when I volunteered at a hospital when I was at Texas A&M, I just wanted to volunteer, kind of get out there, see what the profession was like, because I knew I was kind of interested in nursing. And I volunteered in the ICU, and I was just answering phones and bringing patients water and answering the door. And we had a young girl, a 19-year-old, come in who was in severe DKA, borderline HHS. And the family was just in tears and just watching her. And then you just see this team work together cohesively. You see RTs, physicians, nurses, all in there trying to stabilize this patient. The family's out there. A family member came up to me and she just said, "Thank you so much for everything that you're doing. You guys have changed my life." And I was like, I'm just answering the phone and bringing water. But I realized that to me was, I think, my moment where I was like, I want to do this. I want to make a difference. I want to be the person in that room making a difference and go home at night, knowing that I made a positive change in someone's life. I had a positive impact on this world today. And so I think that's kind of where I knew that I wanted to do something different. And then that's when I was like, I want to go to nursing school. But I also had no idea what I was getting myself into as far as that side goes.
I don't really think any of us do.
No.
I mean, I feel like you can have, 100 nurses in your family that share stories around the dinner table, or anybody else in the medical profession, or even be a CNA for years before you go to nursing school. And until you actually get in there, you're like, oh, I drastically misjudged this.
Yes, I made a terrible mistake. No. But I think also, it's a culture shock for, a new nurse. It really is. And then to have someone, this is why I truly wanted to make the podcast as well, was it's hard to talk to your family members. Oh, how was your day? And it's like, how was my day? And I think that you should make friends with people in the unit, because just to know what other people, just to know that somebody understands what you are going through, and they hear you and they see you and they can relate to you, which is what we want to be for you guys. We want you to vent to us, to share stories. We want to share stories as well about our experiences. We're changing lives every day. We're seeing things that most people should never see happening to children, families. Every day we go to work, it's something different. And that's when I knew, yeah, this is absolutely for me.
Yeah. It's interesting. I can think back to a handful of things. I mean, more than I actually want to count. So I guess more than a handful of just solidifying facts of, hey, you made the right choice kind of thing. But what's interesting to me. So kind of going back a little bit, what you talked about, because as we talk, I love to hear certain things that you say, because it like triggers me. It's like, oh, you know what? That's a good point, because you went back and you said you were just volunteering for a while in a hospital, and all you were doing was answering phones or making copies or anything like that. But what's so interesting to me, and what makes me so happy to hear that, is that a parent came up to you and expressed, gratitude and thank you for everything that you did, as a team, which to me immediately signifies that the team aspect of where you were volunteering was pretty impressive. Because the thing is, as nurses, we do a lot, but we can't do our jobs without respiratory therapists, physical therapists, occupational therapists, speech. You name any of the other disciplines. Even housekeeping. People don't understand how important housekeeping is. And I really didn't either until I started in the oncology and transplant world and realized there are completely different ways to clean up a room when it comes to an immunocompromised patient, but that can be a whole nother episode. Mm-hmm. But if you don't have that good team functionality, especially in a situation when you talk about a critical patient like that, it doesn't function that way. It doesn't work that way. And somebody doesn't notice it and express the gratitude. So you say you're only just somebody that answers phone, but the culture of that whole area that you were at there was clearly one of teamwork, gratitude, respect, appreciation for what everybody does, because that means everybody did their job for that particular patient, to where the parent even noticed that somebody that all they were doing was answering phones, putting in orders, or just maybe, they're just kind of an innocent bystander at times, was still an important member of that. And I think that goes back to the culture.
Mm-hmm. I would say that when I was real nervous, because when I did, when we do our clinicals, they just kind of throw you in and they're like, oh, you're going to shadow this person. And this person just showed up and they're like, oh my God, I'm late first off. I have a student with me, and they just kind of look at you and you're just like, please teach me,
Yeah.
You just sound you're like, the fate of my career is in your hands. Teach me. And you're just like, oh, I'll do anything. I'm a first year, but I'm real eager. I'll do anything. And I think it's just, I was really really nervous. It's just so awkward too.
Yeah, but think about it this way: you walked in and you're nervous, but you're excited. I was the same way. But then think about it, and I can think, I vowed to myself that when I got to that point, I was never going to be that nurse or preceptor, teacher, or whatever. But think about it: immediately the response you got was that the nurse was upset, or I've got to have a student. That drastically, automatically just completely changes your day.
I had a horrible nurse who was going to be, who I was going to be shadowing when I was in the pediatric ER. And ER was something that I thought that I wanted to do. And I had a horrible experience. The charge put me with this nurse because she was late that day. So it was like I was her punishment, and so it ruined my experience. She didn't let me start an IV. She didn't let me do a urine cath or a culture or anything. She didn't let me do blood draws. I didn't get to do anything. I remember pulling out my textbook and I just started reading, just because I was like, okay. And it ruined my experience.
But also what an awful example of teamwork too. If
right.
The charge nurse or the nurse, manager, whoever it was that makes assignments, assigned you as the student to a nurse out of punishment because they were late. I can't imagine that anything, a couple hours into that shift comes up for that nurse, that the teamwork between her and the charge nurse is going to be what's best for the patient or their family. There's one thing, to be late and, to do something about it, but to use a fresh nursing student and this shapeable mind that's trying to come into this profession as punishment for somebody that showed up late. You're asking for potential catastrophic effects later on down the line. Exactly.
And so that's why now, I've had a very good experience when I launched and I graduated and I was a brand new nurse on an intermediate care level unit. I had a great experience, day shift and night shift. My day shift preceptor was incredible. I literally called her my mom. She's in my phone as Mama G, shout out. And I just love her to death. I mean, she really molded me and just sat me down and taught me more than just how to take care of a patient and how to chart, you know. So I have had a really good experience. But I would say that this pandemic has definitely like burnt people out, burnt nurses out. Nurses don't want to teach anymore. There's some things that I have seen from this, not always, but I think it's because nurses have been forced to adjust to do something that they technically didn't sign up for, which is what we hear a lot. And I get it, but we can't set ourselves back. We're only going to be shooting ourselves in the foot if we do something like that.
Yeah, it's interesting that you say that. So would you say that over these last 17 months of this pandemic, it has regressed us?
Absolutely. Yeah.
What would you say is the biggest thing? Because I know what my answer would be.
Well, you go. What would you say your answer is for that? Why are we regressing because of this pandemic?
So I think in the 6 years I've come out, I think the one thing you hear when you go into nursing schools, well, nurses eat their young. Mm-hmm. Nurses eat their young. That's what the culture has been for so long. I would wholeheartedly disagree with that. I would say there was examples of it in nursing school. But if you really sit down and kind of reflect about certain clinical experiences, the staff that was on that unit and things like that, it kind of made sense. And I'm not saying that, older nurses, are bad nurses by any means, because there's good and there's bad nurses of every age, shape, size, everywhere. Mm-hmm. That's what makes this profession so amazing is it's extremely diverse. But what I would say is that it made a little bit more sense because maybe they were a little bit more removed from said nursing school or set opportunities where they were kind of, potentially forced to develop or to adapt to new evidence-based practice. And so then I came out and I had the same thing. My first preceptor on the intermediate care unit, hands down to this day, I still think is probably the best nurse I've ever met in my entire life. And every day I go to work, I'm still like, would she be proud of me for the effort that I just put forth? And so, and I still work with a couple other nurses that were trained by her as well. And I would say the same thing. So, shout out to her as well. And then, I finally transfer into what is my passion and what I've currently been doing now for the better part of 3 years. And same thing, I was thrown into a new specialty. I didn't have to learn how to be a nurse, but I had to learn how to be an oncology transplant nurse. Talk about, terrifying. And preceptor made all the difference there, and things like that. But so I think, though, as being a full-time preceptor myself and in loving teaching and not wanting to give off this mode of I'm gonna eat my young if they're not doing what they're supposed to do or work. I've trained 2 nurses now through this pandemic, brand new nurses coming out of school. So they're not only new nurses, but they're coming into this super specialty thing where things are drastically different. It could be the same skill that you would do on an intermediate care floor, but because you're doing it in an immunocompromised kids, it's completely different.
Right.
And it's difficult because there are things that come up that you were having to adjust to on the fly because of COVID-19 and different precautions we're having to take or different treatments that are now being discovered that I don't even know. But then I'm expected to teach this nurse that as well as I'm learning. And I have found multiple times throughout the experience and days where it gets extremely difficult for me halfway through the shift or so to want to continue to teach this nurse and try to make them the best that they can. And so and then when I talk with my other preceptors, they feel the same way. And so for me, it's crazy. And I feel like we've almost been set back these last 17 months because now what's happening is we're having to teach new nurses new things that we don't even know. So are we teaching it adequately? Probably not. Are the expectations as high from the people above that we are competent at this? Not necessarily, because right now it's mainly about bodies. We just need bodies in the hospital to take care of people. And so now I worry about, 17 months even from now, what is the nursing care going to look like? Have we regressed? Now we were making these huge strides, I felt like, and really putting forth amazing educational programs to train these new nurses out of school to where now we're having to learn and adjust on the fly and everybody's stretched thin or burnt out. And so is the effort there? I don't know. is the research and stuff there? I don't know. It's so much I don't know that I'm almost worried that we're going to put ourselves back a couple of years on the strides that we've made. And the downside of that is it's a snowball effect, right?
Right.
So it's, unless we put it, the nursing culture, the profession or anything like that kind of puts a stop to it now, which is so hard because there's so much unknown. It's just going to continue to snowball because the problem is, and I don't want to say bad nurses, that's not the right way, but maybe not properly trained nurses, but out of the fact that like they got the best training they could at the right time are now going to continually train. And then we end up in what I would say is what we kind of came into 6 years ago is you could tell that it was just poorly educated and trained nurses that continue to poorly educate other people. And so now all of a sudden you have, higher incidence of infections. You have higher incidence of accidents, falls, you name it, because not that, maybe the person's just not good at their job. They just don't catch it.
Yeah. And you just don't, I think one of the things that I've really learned in the past year is that you don't know what you don't know, truly. And when you think about these nurses that were about to graduate, they're in their last year and then they have to go to online learning. What? Everyone's clinicals are canceled? What? You're about to graduate, you're excited. And when you get higher and higher up in your nursing profession, I mean, it was level 4 for us was critical care. Mm-hmm. That would have been one of our last semesters. Can you imagine that clinical getting canceled?
No.
What are you supposed to do? And a lot of these programs that I heard of kind of, still push their kids out. Everything was virtual. It's just like, how are you going to be able to do that? Or you were able to make up your hours, but at this point you were like, I just need to get hours so I can graduate. It wasn't, okay, cool. Like I'm going to go to clinical and I can learn today and get put with somebody who, you really grow with for the next, however many weeks of that program you're in. And I was just kind of like, okay, you need 20 hours of critical care and then you can graduate. And you're just like, I just need to get critical care. I just need to get this. I just need to get ER and then I can leave and I can graduate. And it becomes something forced, not something that you got to look forward to and really absorb in a sense.
Yeah. Well, and you miss out on potential rotations and hours of something that you may have a small interest in or no interest at all. Mm-hmm. And you go through that rotation and all of a sudden you're like, this is my career.
Oh, 100%.
This is my profession.
I had no idea I wanted to do peds. I didn't want to do peds at all. I remember when I was in Future Aggie Nurses at Texas A&M, it was like a nursing group where, they helped you get your prereqs and they had speakers come in and talk about different aspects of nursing. And they were like, who here is interested in peds? And I was like, not me. Heck no. I'm the youngest out of my entire family. I have an older brother. I never babysat. I was like, I don't even think I'd ever changed a diaper. I'm not lying. I had never changed a diaper before in my life. And I was like, no, I'm not doing that. And on my first day of my pediatric rotation, I remember it vividly. I was on a surgical unit and I had the most incredible nurse who was super excited to teach me. And I loved it. And you miss out on that, when it's just, you're forced to just go into your clinical hours and whatever. I got to take my time and go to different units, and pediatrics is its whole other specialty. And then you have those specialties within pediatrics, pedi oncology, it's just what you do, which I love. That's when I was like, okay, Luke and I are going to be friends. It's when you were like, oh, I want to do pedi oncology. I want to wear the superhero scrubs. I want to, do this, that, and the other. And
I have a dozen costumes.
You do? No, I know you do. I've seen your Instagram.
But see, and it's different because so you say that I knew I wanted to do what I'm currently doing since I was 13 years old. Mm-hmm. And, experience is completely different. I have a huge family where I was the babysitter because all of my cousins were almost a decade older than me. Mm-hmm. So by the time I was of age, preteen, teen, where it's like, we could probably trust this guy with another kid. They were having kids. So I knew immediately. I'm like, oh, I'm doing this. Now, as far as the oncology goes, I have no idea. I just kind of, I got exposed to it through high school and everything. And I was just like, you know what? There's something within inside me that I can make a huge difference in these particular kids and these families. But going back, so because we're talking about the culture of nursing and how we think it's maybe changed, regressed, or just the developments and changes we've seen just since we've joined the profession. But what's interesting is you sit here and you might not even have caught it. The main reason you're probably doing exactly what you're doing right now, pediatric ICU, working with kids, families, is because when you walked into your first pediatric rotation through the door, you were met with a smiling, energetic face of a nurse that works in pediatrics that welcomed you and said, come on, let's go learn. And now look what you're doing. And now you're doing the same thing. So it's, when we get back, that's what I'm, the big, takeaway of maybe all of this and everything like this is we get it. We're in it. We're in this thing. You're in it more directly than I am. I have the trickle down effect because, I work with immunocompromised kids. So we're not dealing with the day to day that a lot of our other colleagues or yourself are dealing with because we just can't. We can't potentially expose our kids to that. But we deal with the trickle down. So we have to help where we can because y'all can't help there anymore. But at the same time, like we still have a responsibility to bring the energy at times, even when we don't want to. And it's hard. I know it's hard. But there are still those new nurses, those new grads, nurses that are transferring within the profession to a new specialty to where if their first thing they see is a grumpy, pissed off, I don't want to be here. I have to have a new grad nurse that I have to teach.
Why the hell would
It's
you
only,
really work there?
yeah, well, and it's only going to trickle down, right?
Yeah.
So they're going to start training like that. And then all of a sudden now you're talking about a culture on a unit, just like what our first experience in nursing school was, where you could sit here and be like, man, does anybody like what they do? Like, are these patients safe kind of thing? And so, I mean, that's the best part about wanting to start this podcast, right? Is there are other podcasts and there's other things out there for nurses or medical professionals. And I'm not saying that nobody's better than the other because they're not. I mean, everybody's experiences are just as important. But like, I have a hard time finding currently practicing medical professionals or if somebody that's just in the thick of it, that's, really putting out the content that can kind of relate to the day-to-day things. And that's no pass on anybody else, because maybe they've had some other opportunities, but at the same time, I mean, let's talk about that. Like, how many nurses in the last year have we seen completely get out of bedside nursing that before this all kind of took place, last March with COVID, bedside nursing was going to be their 30 to 40-year career.
Mm-hmm. And now nurses before they're 30 years old, they've left.
Yeah. I mean, we're not even talking about like, taking a travel assignment to go do what they're currently doing. They've just straight up left the bedside area. They've gone into other aspects of nursing or something like that. Or heck, we even know a couple of people that have left nursing they're using their nursing degree that opened up another door, but they're not doing anything medical nursing related.
No.
And so it's where do we go from here? I mean, the pandemic doesn't seem like it's going to slow down anytime soon. I mean, there are instances where you can see hope and you can see that shimmer, but at the same time, that doesn't mean that nothing else is right around the corner. We deal with things every time, right? I mean, wintertime for us, usually RSV, parainfluenza, all these other viruses are crazy. And right now they're rampant because we went for 6 to 8 months without anybody really being around each other. Well, now we're dealing with that on top of a new variant.
Oh yeah. And this new variant is just thriving. And it's thriving off kids too, 100% versus the first wave of the pandemic was more adults. And, my mom was freaking out. She was like, please be safe, please be safe. And I was like, oh, it's mostly just adults. Our census is pretty low, but it's not the case this time.
No.
Not at all. So the culture has dramatically changed. And so whenever you have a student, it's kind of like, oh, well, are they okay with COVID? Like this one is COVID. This one's not COVID, and the COVID is taking up a lot of beds where before we had, these empty beds and stuff like that for like some traumas or for our DKAs or seizures, SIs, whatever. And now they're being taken up. So it's kind of like, oh, you get a little stressed out because that COVID patient, they're always pretty sick. Like they're always very sick. It's not just like, oh yeah, like that one's going to be your COVID assignment and you can't pair them. I can't have a COVID and then like an oncology,
Right.
So it stretches us even more and more been. And then you have the nurses who are saying, well, I didn't sign up for this. I don't want to take a COVID patient. I don't feel comfortable taking a COVID patient, which, is fine. But at the same time, it's kind of like, well, you signed up to help people. It's hard. It's a fine line.
It is. And, and that honestly, that sentence right there has been probably my biggest pet peeve since this whole thing has started, purely because, again, like I said, I'm affected indirectly by all of this, right? So my troubles at work aren't necessarily because it's a COVID patient or anything like that. It's because other people are having to take care of too many of them that we're seeing the complications indirectly. But when I hear people outside of the public say, well, that's what you signed up to do, you're a nurse, there's a difference. There's a huge difference. Yes, we did sign up to take care of people, and for the 99% of us, it's a passion. It's not just a job. We didn't just sign up because, oh, it looks cool. It's a cool schedule. We signed up because we truly want to make a difference. But at the same time, there's a difference between that and being appreciated while doing it. If somebody were to come up to me and we engaged in a good, in an intriguing conversation, asking what I do, and it's like, I just don't know how you do it and everything like that. That's crazy. How are your friends even handling it? Like, you're dealing with it indirectly, but they're dealing with it, completely right in the thick of it. And then, got to the thing. It's like, well, this is kind of what y'all signed up to do. Yeah, we did. I mean, we didn't sign up for a global pandemic, and, there's a lot of things that can be out of our control, but that is a very fiery sentence for somebody to say to somebody who is having to deal with this. And the biggest part of it, and it's hard to put into words, but what's hard is because you hear that and you immediately want to rebuttal, right? Especially like if you were to hear that after coming off of 3 of 3, like you just did, and actually taking care of said patients. And somebody this morning, when you just woke up, be like, well, why are you so tired? Like, you signed up for it. Yeah. I mean, you did. I mean, you signed up for those 3 shifts. You have to work it. It is your thing. But it's these people, it's these outside people, and that's the thing, right? Is we get to this because we're nurses. We understand, and we want people to feel like they can come to us, or they can relate. But we can also relate. It's like, it pisses us off too. But I also have to sit here and say, like, as a nurse, like, it's tough and you got to take care of yourself. But at the same time, like, we still have to remember, like, we have coworkers, we have colleagues that sometimes maybe don't deal with this kind of thing near as beneficially as we do, or as well. And so I've always kind of credited myself, and especially through this, right? Because again, indirectly related, but I've always kind of been the energy guy. I've been the unit energy guy, where it's like, I'm either going to do something stupid to make people laugh at me, either on purpose or a lot of the times just purely by coincidence, or say something, or just kind of just lighten the mood. And I think what's happening is those people are even starting to fade away because they're getting so burnt. And that's what breaks my heart, because that's when the morale drops to a point where is it a point of no return? So I mean, you're in it. Are we potentially looking at a point of no return?
That's heavy. I think that it's really weeding out, like, nurses in general it's like, how bad do you want to stay in this profession? I feel like sometimes I will go home and I'm like, gosh, like, or when I'm at work, I'm like, I love my job. I love my job. I love my job. I never really had to do that before, but there are moments, not saying I do it all the time, but there are moments now where I'm like, oh my gosh, because, the family member is upset because the visiting policy has changed. And their kid is so sick that they're like, well, I mean, it's mom, me, it's me, dad, and grandma. And, grandma raised her. And I'm like, I'm sorry. It's 2 visitors only. Like, that's our policy right now. On the adult side, it's no visitors. I remember holding up a phone so that way my patient could FaceTime his family. And there was just like, he was in the room. It was just glass separating us, and I'm there holding up the phone. It's just insane. It's insane. And you go home and you're just like thinking about that. Like, that hurts. That hurt me, And I would say that it's making people choose, I don't want to do that every day. I would say that it is changing the culture for sure.
It's making people lose a passion for something they've known that they wanted to do for a long, long time, or have been doing it for a long, long time. And it's crazy. And as we sit here and talk about it, and then, when we were introducing this whole thing, we wanted to be a place of venting and success and triumph, but also a place where you could, come cry, share stories, relate to us. But at the same time, when we both set out to do this, we also wanted to be a place where we could recommend or share what has worked for us to get us to this point. And when we talk about specifically, culture of nursing as it stands today and the effects that the COVID-19 pandemic have had on it, there are days that both of us are like, man, I don't really think I want to go to work. But we've both done things or have made it a point to continue to do some things to where we can get over that. And when we walk through the door, it's like, you know what? Yeah, I'm glad I was here. I'm going to go make a damn difference.
Right.
And so,
it's
for you, for you, so you just came off a 3 of 3. And as a night shifter, I know a lot of the times you prefer that. And when I've picked up night shifts, I have to do that, because if I try to flip flop back and forth, I won't make it. I literally just will not. I will not survive. So, coming into this thing, boom, we're face planted. All of a sudden, your ICU is full of these patients, and get 6 months into it, and I don't even know what to do. Yeah, how do you gear yourself up to continue to go to work, to make a difference, but not to just make a difference by passing meds or doing your assessments or monitoring vital signs? Like, how do you go in there and you're like, you know what, I'm going to still be the same nurse Tori I was in May of 2018 that I am in May of 2020, May of 21?
I would say what has kept me going is just knowing that I didn't get into nursing to do it for myself. I did it to help other people. I know that's why you got into nursing. Yeah. We enjoy helping people. We always have. And so I think once I found myself in kind of a dark place, and I was really starting to get burned out, and I was like, I haven't even been doing this for 3 years. I haven't even been doing ICU for a year yet, and I just felt burnt. And I was like, I just had to take a step back and evaluate and just remember why I got into nursing. It was to help people, and I love helping people, and I love my coworkers. And I think that's really what motivates me every day, is to go in and, the media is just saying a million different things. And so people don't know what to believe. And so when parents and families come in, they automatically think it's like a death sentence, and they think the worst, or they think this and that. And I love educating. So I love teaching new nurses. I like having preceptees. I like having students, because I want to be that person to say, hey, let's see if you made the right decision. This is what this has to offer. I like doing that for families. And so I think that's what keeps me going, is I want to make a difference. I want to teach this family, hey, I want to keep them informed. I want to let them know what's going on. I like learning new things. So I think for me, I had to take a step back and really look at myself in the mirror and just tell myself, hey, remember why you did this. And I shifted my mindset. And I really think that's what keeps me going. And actually, I do look forward to going to work. I always have. For a while there, it was rough. But I think now, once I shifted my mindset and just, I walk in, listen to some music while I walk into the unit, and just think, all right, let's go to work. Let's help some people today. Let's save some kids. Let's educate a family member, because I want to make a difference. I want to feel that same feeling that I felt when I was at that facility with that young 19-year-old girl who was a DKA. And her family looked at me and they said, thank you so much. And they were crying. Yeah. I want to be that person again. I want to go home having an impact again. So that's what keeps me going. But I know that you have had I would say you've had the most culture shift in general as far as oncology goes, because you were so specialized, and that's what, you were saying, okay, I want to do this, I want to do oncology. That's changed. So how do you feel, how much has it changed for you, and what would you say is what keeps you going?
It's tough. So, the first thing that I always like to tell people is we win a lot more than we lose. But there's no middle ground in my specialty. When there's good days, they're really, really good. Like, they're amazingly good. And unfortunately, when there's bad days, they're just really bad. There's very, very few, a very fine line of middle ground within that specialty. It's a true line of win and loss. Like, there's no, I guess you could put it in sports reference, a tie a lot of the times. The most difficult thing is, so I had been doing this already for a little over 2 years before the pandemic had hit, right? And so when you have those good days, somebody's completed treatment for the last time, or they've recovered from a stem cell transplant and they literally have a second chance at life now. You want to talk about a party? Go to a pediatric oncology floor when one of those days takes place, when there's not a pandemic going around, and you'll talk about the greatest party you ever went to in your life. Well, that immediately goes away, because now you're talking about a party of 30, 40, sometimes 50 people, whether it's friends, family, and employees that all want to partake because they've gotten to know this family or this patient, or they just want to celebrate because it's a happy day. They just beat cancer. That's gone. But guess what? Kids are still completing treatment and recovering from stem cell transplants. And now they're walking out to go ring a gold bell, which is symbolic in our world, with maybe a handful of the nurses working that day, one parent, because that's all they get. And as we get further into this, I hate to say it, but the energy and celebratory level of the staff at times can be low, because it's a great day, and it's not that we're not excited, but we've been beat down. And so it's difficult, but like you said, it's the same thing for me. It's a mindset. Like, I've always been the energy guy, and I want to continue to do that. Whether it's for my colleagues on the same floor that I work in, or ones in the ICU like yourself, the ER, anything like that, where even if it's just like a phone call for 5 minutes to ask if they have a certain supply that we don't have, or heck, even just talk about report on a patient coming in, maybe I can, say something, or just the way I answer the phone, maybe it changes maybe an hour of their day, because I energized them by my response of, hey, what's going on? It's Luke, or hey, go for Luke, kind of just some weird, just totally stupid way to answer the phone or whatever, because I know he's calling. Yeah. But it's just things like that. And it's what's the best part. And I think what ultimately is going to lead to the success of this platform that we want to establish is that we're not going to hide anything. We're going to share what we're going through. We're going to allow our friends and colleagues to share what they're going through and get it, because I think there's also a stigma, and I think there's a stigma from the general public when it comes to nurses, and we can say medical professionals in general, but nurses especially, because, the start and the height of the pandemic, right, 2020, that's the year of the nurse. That's when old Flo said, hey, X amount of years from this moment right now, this is where people are going to be like, nurses they're the shit. They are like, boom. She wasn't wrong. I mean, the world gave us an area where people really, but the problem was it lasted and still going on. And now I think there's a stigma that's like you said, we go back to, well, you signed up for it, so you can't talk about it. Like, you don't have a right to sit here and talk about how tough it is. Like, that's your job. You signed up for it, which I'd say bull.
Yeah.
Absolute bull. But at the same time, I also don't see, and there could be, and that could just be me, I don't see outlets for nurses to feel like they can. And I'm not saying facilities and stuff like that aren't offering it. I just feel like you're so tired at the end of your shift or coming into another shift that the last thing you want to do is maybe take a little bit more time away from your sleep to do that. Well, you know what? You have to get in a car or ride some type of transportation most of the time to get to your said job at said facility. And, you can pop some headphones in and listen to, us talk about the current things that are going on or recommendations, suggestions that we have when it comes to it. And not every episode we're just going to be heavy, right? We want to get into certain things where it's like, it's fun. Like, hey, you work night shift. How the heck do you even work out every day? Like, because if the sun's up, like, do you burn? You know what I mean? Like, kind of stuff. We want to do that, but something where you can, for 30 minutes to an hour, you pop in some headphones, you turn it on your radio, and you're like, man, those two get me, or hey, maybe I can get them to talk about something that I'm going through that others are, and they can reach them. That's the hope one day, right? To be able to reach nurses everywhere. Right. But at the end of the day, like, somebody needs to talk about this. Somebody needs to offer suggestions. Somebody needs to just openly share, like, hey, this is what I'm going through. This is why I do this profession. And this is how I try to make myself successful at it. Because ultimately, at the end of the day, it could help somebody, right? And that's what nursing is all about, is helping somebody and make a difference.
Right. And we want to help, who helps nurses? Who helps the nurses, And that's just kind of what we want to be, is we want to be a platform where we can all share stories. We can give advice. We want to have you guys writing in. If you guys want us to talk about something, share a story, what keeps you guys going, we want to talk about it. And we want to get it out there for other RNs, because I saw facilities making PPE out of trash bags in the year of the nurse. That should not be happening. But it did. But we weren't even allowed to talk about it. And we want to talk about it. We want to talk about how it made us feel. We want to talk about how we got through it. And we just want to be a safe place where everyone can share their stories. We can all laugh together. And like Luke and I get it. We know what you guys have gone through these past 17 months, and it's been nothing short of hell. But we want to be an outlet for sure. And I feel like it's pretty heavy right now, but we got to talk about it.
We have to. It's what's currently going on.
Yeah.
And you know what? I've always said, since I started this thing and I became old enough and mature enough to understand, I always told myself and other people that I wasn't going to be somebody that swept something under the rug, that I wasn't going to see something in a friend, a colleague, or anything like that concerned me and just be like, they probably already have some help. It's real easy to sit there and be like, hey, hey, what's going on? Or, hey man, you want to go grab something to eat? Or, hell, you don't even have to talk about something. Like I said, most of this is going to be so lighthearted and fun. I look forward to hearing, superstitions or great stories or triumphs or why you got into nursing, or just, ridiculous things that maybe happened to you that, maybe got embarrassed about a little bit, but it's just a funny story. Like, we all have them. Trust me, I will share plenty of them. But at the same time, if we don't start taking care of each other as nurses and lift each other up, encourage each other, cheer for each other, or sometimes just cry with each other, this profession is just going to regress into an area that was there for so long that we all heard about when we started nursing school. And it's just going to be a continuous cycle. Well, guess what? I want to be part of the nursing generation that doesn't allow that to happen. I want to break that cycle. I want to break that stigma. I want it to be, when people talk about nursing, I want it to be what Flo intended, over 200 years ago or whatever it was when she first developed this profession. I want it to be like, man, that's a nurse.
Yeah.
That's a nurse. And that's cool. That's cool. I want to be that.
Yeah.
But at the same time, I want my friends to still want to come to work, even if it's purely just because, like, I'm there or somebody else is there. Because if everybody continues down the path of, I'm over this, even your best friend that you might work with, you might not want to work with them anymore because you're like, that doesn't even do it for me. Mm-hmm. So, but, it's going to be fun. We've talked about this for a long time, wanting to do it. We're finally making it happen. It was fun, buying all the equipment and figuring out what we're going to do.
We're really excited.
Only if a handful of people, listen to it first off or anything like that, great. But anybody that does, tell everybody else if you enjoyed it. If if you like listening to us talk or whatever. But otherwise, we've started to set up some social media. We've set up an email so people can write in, because sometimes we just want to have a whole episode where we just read letters, because if somebody just wants to be heard, we want to help them be heard. So, email us at alertandorientedrn@gmail.com. The "and" is spelt out because it wouldn't let us do the ampersand. Social media to closely follow on Instagram, probably Facebook, maybe not, but Instagram for sure. But yeah, we just want to hear from you. We want to hear your stories over the last 17 months. We want to hear your stories from 10 years ago if you've been a nurse for 10 years. Let us know. Let's talk about it. And at the same time, let's make this profession better.
Let's do it. I'm down. I'm so ready. We've been wanting to do it for a long time. And I think that the timing just was weird last year. And I think we're ready to finally be able to share our experiences. We want to hear about yours. It's only going to make the profession stronger, better. I just can't wait. I can't wait.
Me either. We're gonna be on all platforms where you can find podcasts, or going to figure out how to upload it.
Yeah, Spotify, Apple.
We're gonna do everything just us two. So, oh boy. But anyway, guys.
All right, y'all. Thanks for tuning in, listening to our first episode. We're really excited to see where this goes. We really want it to take off. So follow us, Alert and Oriented RN. We're going to make an Instagram, all that good stuff. So we'll see you guys in the future. We'll put some polls out there. You guys can share, hey, we want to hear about this, or what was your experience with this, or hey, I want to share a story about this. We'll do certain episodes based on certain experiences and funny stories, ghost stories.
Yeah, all of it.
All of it, for sure.
Awesome. Peace.
All right, guys. Peace out. Thanks for tuning in with us.